A patient has been started on therapy of a continuous infusion of lidocaine after receiving a loading dose of the drug. The nurse will monitor the patient for which adverse effect: A. Drowsiness, B. Nystagmus, C. Dry mouth, D. Convulsions. Answer: D. Convulsions. Rationale: convulsions are possible if lidocaine reaches toxic levels. The other options are not adverse effects of lidocaine. A 62-year-old man is to receive lidocaine as treatment for a symptomatic dysrhythmia. Upon assessment, the nurse notes that he has a history of alcoholism and has late-stage liver failure. The nurse will expect which adjustments to his drug therapy? A. The dosage will be reduced by 50%. B. A diuretic will be added to the lidocaine. C. The lidocaine will be changed to an oral dosage form. D. An increased dosage of lidocaine will be prescribed so as to obtain adequate blood levels. Answer: A. The dosage will be reduced by 50%. Rationale: because lidocaine is metabolized primarily by the liver. A reduction of the dosage by 50% may be necessary in cases of liver failure or cirrhosis. Lidocaine does not come in oral form. A patient is in the intensive care unit because of an acute myocardial infarction. He is experiencing severe ventricular dysrhythmias. The nurse will prepare to give which drug of choice for this dysrhythmia? A. Diltiazem, cardizem, B. Verapamil, Calin, C. Amiodarone, Codarone, D. Adenosine, Adenocard. Answer: C. Amiodarone, Codarone. Rationale: amiodarone, Codarone, is the drug of choice for ventricular dysrhythmias according to the Advanced Cardiac Life Support Guidelines. The other drugs are not used for acute ventricular dysrhythmias. Sodium channel blockers are considered which class of antidysrhythmic drugs? A. Class 3B, Class 2C, Class 4D, Class 1. Answer: D. Class 1. Rationale: the von Williams classification is the most commonly used system to classify antidysrhythmic drugs. There are 4 major classes of antidysrhythmic drugs: I, 2, 3, and IV. Sodium channel blockers are classified as Class 1 drugs. For patients prescribed amiodarone, Codarone, the nurse should monitor for which potential adverse effects of this drug. Select all that apply. A. Hypothyroidism, B. Visual halo, C. Photosensitivity, D. Blue-gray skin discoloration, E. Overgrowth of gum tissue, F. Diarrhea. Answer: A. Hypothyroidism, B. Visual halo, C. Photosensitivity, D. Blue-gray skin discoloration. Rationale: potential adverse effects from amiodarone include visual halos, photosensitivity, photophobia, dry eyes, bluish skin discoloration, hyperthyroidism, hypothyroidism, constipation, and decreased libido. To prevent the occurrence of synchonism in a patient prescribed quinidine, Quindex, which instruction is most important for the nurse to provide for this patient? A. Increase dietary intake of potassium. B. Avoid drinking grapefruit juice. C. Advise the patient to wear sunscreen every day. D. Remind the patient to change position slowly. Answer: B. Avoid drinking grapefruit juice. Rationale. Grapefruit juice can inhibit the metabolism of quinidine, which increases the risk of synconism. The nurse is caring for a patient prescribed amiodarone, codarone. The nurse knows the most serious adverse effect of this medication can occur in which body system? A. Immune, B. Nervous, C. Gastrointestinal, D. Respiratory. Answer. D. Respiratory. Rationale. Pulmonary toxicity is the most serious potential adverse effect of amiodarone. A patient will be discharged on quinidine sulfate, Quinidex, extended-release tablets for the treatment of ventricular ectopy. The nurse will include which information in the teaching plan? A. The medication should be stopped once the cardiac symptoms subside. B. Signs of synconism, such as tinnitus, loss of hearing, or slight blurring of vision, may occur. C. It is important to use sunscreen products when outside because of increased photosensitivity. D. If any tablet or capsule is visible in the stool, contact the prescriber immediately. Answer. B. Signs of synconism, such as tinnitus, loss of hearing, or slight blurring of vision, may occur. Rationale. Quinidine, a cinchona alkaloid, may cause the symptoms of synconism, including tinnitus, loss of hearing, slight blurring of vision, and gastrointestinal upset. The medication will need to be continued even after symptoms subside, or the symptoms may return. Tablets or capsules that are visible in the stool are actually the wax matrices that contain the drug. The medication is extracted while in the intestines. Photosensitivity occurs with Class 3 drugs, not with quinidine, Class IA. A patient who has heart failure receives digoxin, lanoxin, and an angiotensin-converting enzyme, ACE inhibitor. The patient will begin taking spironolactone, aldactone. The patient asks why the new drug is necessary. The nurse will tell the patient that spironolactone will be given for which reason? A. To enhance potassium excretion. B. To increase cardiac contractility. C. To minimize fluid losses. D. To provide cardioprotective effects. Answer. D. To provide cardioprotective effects. Rationale. Spironolactone is a potassium-sparing diuretic that blocks production of aldosterone, causing improved heart rate variability and decreased myocardial fibrosis. It is given in congestive heart failure for its cardioprotective effects. Spironolactone does not directly alter cardiac contractility but may slightly decrease contractility if fluid volume is decreased. It is a mild diuretic but is not given in this instance to minimize fluid losses. A patient who has heart failure receives digoxin, lanoxin, and an angiotensin-converting enzyme, ACE inhibitor. The patient will begin taking spironolactone, aldactone. The patient asks why the new drug is necessary. The nurse will tell the patient that spironolactone will be given for which reason? A. To enhance potassium excretion. B. To increase cardiac contractility. C. To minimize fluid losses. D. To provide cardioprotective effects. Answer. D. To provide cardioprotective effects. Rationale. Spironolactone is a potassium-sparing diuretic that blocks production of aldosterone, causing improved heart rate variability and decreased myocardial fibrosis. It is given in congestive heart failure for its cardioprotective effects. Spironolactone does not directly alter cardiac contractility but may slightly decrease contractility if fluid volume is decreased. It is a mild diuretic but is not given in this instance to minimize fluid losses. Calcium channel blockers have which pharmacodynamic effect? A. Positive chronotropic, B. Shortened refractory period, C. Positive inotropic, D. Coronary vasodilation. Answer: D. Coronary vasodilation. Rationale: calcium channel blockers cause coronary vasodilation, a negative inotropic effect, a negative chronotropic effect, and a negative dromotropic effect. Which drug class is used to treat both hypertension and antidysrhythmias? A. Direct-acting vasodilators, B. Alpha-adrenergic blocking, C. Sodium channel blockers, D. Calcium channel blockers. Answer: D. Calcium channel blockers. Rationale: calcium channel blockers are effective in treating both hypertension and dysrhythmias secondary to their negative inotropic and chronotropic effects. Before administering a dose of an antidysrhythmic drug to a patient, what is the priority nursing assessment? A. Measure urine output and specific gravity. B. Check apical pulse and blood pressure. C. Evaluate peripheral pulses and level of consciousness. D. Obtain temperature and pulse oximetry on room air. Answer: B. Check apical pulse and blood pressure. Rationale: antidysrhythmic drugs can cause both hypotension and bradycardia, therefore, it is important to assess blood pressure and apical pulse before administration. Peripheral pulses are not as reliable as the apical pulse assessment. The nurse understands adenosine, adenocard, is used to treat which condition? A. Atrial fibrillation, B. Second-degree atrioventricular block, C. Paroxysmal supraventricular tachycardia, PSVT, D. Atrial flutter. Answer: C. Paroxysmal supraventricular tachycardia, PSVT. Rationale: the only therapeutic indication of use for adenosine is the treatment of PSVT. The nurse is reviewing the protocol for administration of IV adenosine, adenocard. What is the most important nursing intervention to remember when giving this medication? A. Monitor the infusion site for hematoma. B. Assess for burning sensation at the IV site. C. Flush the IV catheter with normal saline. D. Administer it as a fast IV push. Answer: D. Administer it as a fast IV push. Rationale: adenosine must be given as rapidly as possible, followed by a 50 ml normal saline flush in order to get all of the medication into the circulation quickly, since the half-life of adenosine is less than 10 seconds. A patient is receiving lidocaine, xylocaine, by continuous intravenous, IV, infusion. The nurse understands this medication is prescribed for what condition? A. Ventricular dysrhythmias, B. Sinus bradycardia, C. Atrial fibrillation, D. First-degree heart block. Answer: A. Ventricular dysrhythmias. Rationale: lidocaine is a sodium channel blocker drug used specifically to treat ventricular dysrhythmias. Which nursing diagnosis is appropriate for a patient receiving antidysrhythmics? A. Risk for infection, B. Deficient knowledge, C. Deficient fluid volume, D. Urinary retention. Answer: B. Deficient knowledge. Rationale: deficient knowledge related to lack of experience with medication therapy as a potential nursing diagnosis for a patient receiving antidysrhythmics. The other options are incorrect. A patient is taking Procainamide, Pronestal, for a cardiac dysrhythmia. The nurse will monitor the patient for which possible adverse effect: A. Bradycardia. B. Shortened QT interval. C. Dyspnea. D. Diarrhea. Answer: D. Diarrhea. Rationale. Diarrhea is a potential adverse effect of procainamide therapy. Prolonged QT interval on the ECG is also possible. The other options are incorrect. The nurse is reviewing the classes of antidysrhythmic drugs. Amiodarone, Codarone, is classified on the von Williams classification as a Class 3 drug, which means it works by which mechanism of action? A. Blocking slow calcium channels. B. Prolonging action potential duration. C. Blocking sodium channels and affecting phase 0D. Decreasing spontaneous depolarization and affecting phase 4. Answer: B. Prolonging action potential duration. Rationale. Von Williams Class 3 drugs, amiodarone, dronedarone, sotalol, ibutylide, and dofetilide, increase the action potential duration by prolonging repolarization in phase 3. The other answers are incorrect. The nurse is monitoring for adverse effects in a patient who is receiving an amiodarone, Codarone, infusion. Which are adverse effects for amiodarone? Select all that apply. A. Tachycardia. B. Constipation. C. Chest pain. D. QT prolongation. E. Headache. F. Hypotension. G. Blue-gray coloring of the skin on the face, arms, and neck. Answer: B. Constipation. D. QT prolongation. F. Hypotension. G. Blue-gray coloring of the skin on the face, arms, and neck. Rationale. There are numerous adverse effects of amiodarone, including pulmonary toxicity, thyroid disorders, bradycardia, hypotension, saw node dysfunction, QT prolongation, blue-gray coloring of the skin, face, arms, and neck, constipation, and others. Tachycardia, chest pain, and headache are not adverse effects of amiodarone therapy. Which patient teaching instructions are appropriate for a patient taking an antidysrhythmic drug? Select all that apply. A. Do not chew or crush extended-release forms of medication. B. Take the medication with food if gastrointestinal distress occurs. C. If a dose is missed, the missed dose should be taken along with the next dose that is due to be taken. D. Take the medications with an antacid if gastrointestinal distress occurs. E. Limit or avoid the use of caffeine. F. The presence of a capsule in the stool should be reported to the physician immediately. Answer: A. Do not chew or crush extended-release forms of medication. B. Take the medication with food if gastrointestinal distress occurs. E. Limit or avoid the use of caffeine. Rationale. Appropriate teaching instructions for a patient taking an antidysrhythmic drug include: do not chew or crush extended-release forms. If gastrointestinal distress occurs, take the drug with food. And limit or avoid the use of caffeine. Do not double medication doses or take medications with an antacid. The presence of a portion of a capsule or tablet in the stool is actually the wax matrix that carried the medication, which has been absorbed. The physician does not need to be notified. The nurse notes in the patient's medication orders that the patient will be taking ibutylide, Corvert, Based on this finding, the nurse interprets that the patient has which disorder? A. Ventricular ectopy. B. Atrial fibrillation. C. Supraventricular tachycardia. D. Bradycardia. Answer: B. Atrial fibrillation. Rationale: Ibutylide, Corvert, is one of two Class III antidysrhythmic drugs available for rapid conversion of these atrial fibrillations and atrial flutters into normal sinus rhythm. A patient is in the emergency department with a new onset of rapid rate atrial fibrillation, and the nurse is preparing a continuous infusion. Which drug is most appropriate for this dysrhythmia? A. Diltiazem, cardizem. B. Atenolol, tenormin. C. Lidocaine. D. Adenosine, adenocard. Answer: A. Diltiazem, cardizem. Rationale: Diltiazem, cardizem, is indicated for the temporary control of a rapid ventricular response in a patient with atrial fibrillation or flutter and paroxysmal supraventricular tachycardia. It is given by continuous infusion after a loading dose given by IV bolus. The other options are incorrect. When starting a patient on antidysrhythmic therapy, the nurse will remember that which problem is a potential adverse effect of any antidysrhythmic drug. A. Deficiency of fat-soluble vitamins. B. Hyperkalemia. C. Heart failure. D. Dysrhythmias. Answer: D. Dysrhythmias. Rationale: Many antidysrhythmic are themselves capable of producing new dysrhythmias, the prodysrhythmic effect. The other options are not adverse effects of antidysrhythmic drugs. A patient is taking digoxin, linoxin, and develops a dysrhythmia. The nurse reports this finding to the prescriber, who will most likely order what? Select all that apply. A. Amiodarone. B. Diltiazem. C. Phenytoin, dilantin. D. Quinidine. E. Serum electrolytes. Answer: C. Phenytoin, dilantin. E. Serum electrolytes. Rationale: Phenytoin is an anti-seizure medication used to treat digoxin-induced dysrhythmias. Because digoxin-induced dysrhythmias can be caused by hypokalemia, it is appropriate to evaluate the serum electrolyte levels. Amiodarone, diltiazem, and quinidine increase digoxin levels. The nurse is teaching a group of nursing students about dofetilide, Ticosin, to treat dysrhythmias. Which statement by a student indicates understanding of the teaching? A. Dofetilide as a first-line medication to treat atrial flutter or atrial fibrillation. B. Dofetilide carries a lower risk of causing torsades de pointes than other drugs. C. Dofetilide is used for patients with severe symptoms of atrial dysrhythmias. D. Dofetilide may be safely used as outpatient therapy to treat atrial fibrillation. Answer: C. Dofetilide is used for patients with severe symptoms of atrial dysrhythmias. Rationale: Dofetilide is used for patients with severe, highly symptomatic atrial dysrhythmias because of its higher than usual risk of torsades de pointes. It is used only when other medications have not been effective. It is used for hospitalized patients with close ECG monitoring. The nurse educator is providing patient education about the Cardiac Arrhythmia Suppression Trial, CAST. The nurse correctly explains that the trial demonstrated what effect from the pharmacologic suppression of dysrhythmias: A. It reduced mortality by 50% but increased morbidity. B. It significantly reduced the risk of a second myocardial infarction, MI. C. It doubled the risk of a second MI. D. It should be used in all patients who have had an MI, regardless of rhythm. Answer. C. It doubled the risk of a second MI. Rationale. In the CAST, Class IC dysrhythmic drugs were used to prevent dysrhythmias after MI. These drugs were found to actually double the rate of mortality. The antidysrhythmic drugs did not reduce mortality or the risk of a second MI. They should not be used for any MI patients with associated dysrhythmias unless the dysrhythmias are life-threatening. The nurse is teaching a class on dysrhythmias and associated therapy. The nurse asks the class, which cardiac dysrhythmia would result in the lowest cardiac output, and what treatment would be effective. The class best demonstrates understanding by responding that what results in the lowest cardiac output and treatment includes A. Atrial flutter, lidocaine. B. Tachycardia, atropine. C. First-degree heart block, verapamil, kaolin. D. Ventricular fibrillation, defibrillation. Answer. D. Ventricular fibrillation, defibrillation. Rationale. With ventricular fibrillation there is no cardiac output, because the pumping action of the heart stops. Treatment with electrical countershock is indicated to restore cardiac function. Atrial flutter, tachycardia, and first-degree heart block do not result in the lowest cardiac output. A nursing student asks a nurse how digoxin causes dysrhythmias. The nurse correctly states that digoxin A. reduces automaticity in the AV node. B. increases automaticity in the Purkinje fibers. C. increases automaticity in the SAW node. D. speeds up AV conduction. Answer. B. increases automaticity in the Purkinje fibers. Rationale. Digoxin increases automaticity in the Purkinje fibers, which contributes to dysrhythmias caused by digoxin. Decreased automaticity in the AV node as a desired effect of digoxin. Digoxin does not increase automaticity in the SAW node. It does not increase AV node conduction. A nurse is discussing adenosine with a nursing student. Which statement by the student indicates a need for further teaching? A. Adenosine acts by suppressing action potentials in the SAW and AV nodes. B. Adenosine can be used to prevent paroxysmal supraventricular tachycardia and Wolff-Parkinson-White syndrome. C. Adenosine has a half-life that lasts only a few seconds and must be given intravenously. D. Adenosine is not effective for treating atrial fibrillation, atrial flutter, or ventricular dysrhythmias. Answer. B. Adenosine can be used to prevent paroxysmal supraventricular tachycardia and Wolff-Parkinson-White syndrome. Rationale. Adenosine is used to terminate paroxysmal supraventricular tachycardia, SVT, and Wolff-Parkinson-White, WPW, syndrome, not to prevent symptoms. Adenosine suppresses action potentials in the SAW and AV nodes. Because it has a very short half-life of 1.5 to 10 seconds, it must be given IV bolus, as close to the heart as possible. Adenosine is not active against atrial fibrillation, atrial flutter, or ventricular dysrhythmias. A prescriber orders verapamil, Covera-HS, for a patient who is taking digoxin, lanoxin, and warfarin. The nurse will expect the prescriber to what the dose of A. Lower. Digoxin. B. Increase. Digoxin. C. Lower. Warfarin. D. Increase. Warfarin. Answer. A. Lower. Digoxin. Rationale. Calcium channel blockers, such as verapamil, can increase levels of digoxin, so patients taking these drugs may need to have their digoxin dose reduced. Increasing the dose of digoxin can result in digoxin toxicity. Verapamil does not affect warfarin levels. A nurse is providing teaching to a patient who is admitted to the hospital for initiation of treatment with amiodarone, codarone, for atrial fibrillation that has been refractory to other medications. Which statement by the patient indicates a need for further teaching? A. I may have itching, malaise, and jaundice, but these symptoms will subside. B. I need to use sunblock to help keep my skin from turning bluish-gray. C. I should not drink grapefruit juice while taking this medication. D. I should report shortness of breath and cough and stop taking the drug immediately. Answer. A. I may have itching, malaise, and jaundice, but these symptoms will subside. Rationale. Amiodarone has many toxic effects. Liver toxicity is rare but serious and should be reported and the drug discontinued. Dermatologic toxicity can occur, and sunblock helps protect the skin, which, with prolonged exposure to the sun, can turn bluish-gray. Drinking grapefruit juice can increase amiodarone levels. Pulmonary toxicity is the greatest concern, and patients with pulmonary symptoms should report these to the provider. A prescriber has ordered propranolol, Inderal, for a patient with recurrent ventricular tachycardia. The nurse preparing to administer this drug will be concerned about what in the patient's history. A. Asthma. B. Exercise-induced tachyarrhythmias. C. Hypertension. D. Paroxysmal atrial tachycardia associated with emotion. Answer. A. Asthma. Rationale. Propranolol is contraindicated in patients with asthma because it is a non-selective beta-adrenergic antagonist and can cause bronchoconstriction and exacerbate asthma. It is used to treat tachyarrhythmias and paroxysmal atrial tachycardia evoked by emotion, so it is not contraindicated for patients with these conditions. It lowers blood pressure, so it would be helpful in patients with hypertension. A patient with diabetes develops ventricular tachycardia and is in the hospital for evaluation of this condition. The nurse reviews the history and learns that the patient takes mexiletine, Mexitil, for pain caused by peripheral neuropathy. What should the nurse do? A. Discuss common side effects associated with taking mexiletine with cardiac agents. B. Understand that this drug will help with both peripheral neuropathy and dysrhythmias. C. Notify the provider to request that another drug be used for peripheral neuropathy pain. D. Request an order for renal function and hepatic function tests. Answer. C. Notify the provider to request that another drug be used for peripheral neuropathy pain. Rationale. Mexiletine is an antidysrhythmic medication that can also cause dysrhythmias. It is used to treat the pain associated with peripheral neuropathy in diabetic patients, but it is contraindicated in diabetic patients with heart disease. And so it should be stopped now that this patient has developed a heart disorder. Because it is contraindicated, the nurse will not teach the patient about side effects with other agents. It can exacerbate cardiac symptoms, so it should not be used to treat dysrhythmias in diabetic patients. There is no indication for tests of renal and hepatic function. A nurse is caring for a patient in the intensive care unit who is receiving intravenous lidocaine. The patient is drowsy and confused and reports numbness of the fingers and toes. Which standing order will the nurse initiate at this time? A. Administer diazepam. B. Reduce the rate of infusion. C. Discontinue the infusion. D. Prepare for mechanical ventilation. Answer. B. Reduce the rate of infusion. Rationale. This patient is showing signs that are common with high therapeutic levels of lidocaine. Because lidocaine is rapidly degraded, slowing the rate of infusion can help remove excess drug from the circulation. Seizures are possible with toxic doses. Diazepam should be used to control seizures. It is not necessary to discontinue the infusion because this patient is showing signs common to high therapeutic doses. Respiratory arrest is possible with toxic doses. Mechanical ventilation may be needed. A nurse provides teaching for a patient who will begin taking Procainamide, Procainamide, for long-term suppression of a dysrhythmia. Which statement by the patient indicates a need for further teaching? A. I need to take this drug at evenly spaced intervals around the clock. B. I may have increased bruising, but this is a temporary side effect. C. I should report pain and swelling in my joints when taking this drug. D. I will need to have blood tests at regular intervals while taking this drug. Answer. B. I may have increased bruising, but this is a temporary side effect. Rationale. Blood dyscrasias are a rare but potentially fatal side effect of procainamide and are an indication for withdrawing the drug. Procainamide should be taken around the clock at evenly spaced intervals. Lupus-like symptoms may occur. Inflammation of the joints is one manifestation and should be reported so that anti-nuclear antibody, ANA, titers can be monitored. Because of the risk of lupus-like symptoms and blood dyscrasias, blood tests need to be done weekly at first and then periodically thereafter. A patient is taking digoxin, lanoxin, and quinidine to treat sustained ventricular tachycardia. Before giving medications, the nurse reviews the patient's electrocardiogram, ECG, and notes a QRS complex that has widened by 50% from the baseline ECG. What will the nurse do? A. Administer the medications as ordered, because this indicates improvement. B. Contact the provider to discuss reducing the digoxin dose. C. Contact the provider to request an increase in the quinidine dose. D. Withhold the quinidine and contact the provider to report the ECG finding. Answer. D. Withhold the quinidine and contact the provider to report the ECG finding. Rationale. Quinidine widens the QRS complex by slowing depolarization of the ventricles. As cardiotoxicity develops as a result of quinidine toxicity, the QRS complex widens excessively. Any widening of the QRS complex of 50% or more warrants notifying the provider. So the nurse should withhold the medication and contact the provider. Widening of the QRS complex by more than 50% of baseline indicates cardiotoxicity. Quinidine can double digoxin levels, so it is not likely that the digoxin dose would need to be increased, and an increase in the QRS complex does not indicate a need for more digoxin. The quinidine dose should not be increased, because the findings indicate cardiotoxicity from the quinidine. A nurse is teaching a group of nursing students about antidysrhythmic medications. Which statement by a student indicates understanding of the teaching? A. Antidysrhythmic drugs can cause new dysrhythmias or worsen existing ones. B. Adverse effects of these drugs are mainly non-cardiac in nature. C. For most antidysrhythmic drugs, there is evidence of reduced mortality. D. Use of these drugs may be necessary even if the benefits are unknown. Answer. A. Antidysrhythmic drugs can cause new dysrhythmias or worsen existing ones. Rationale. Because antidysrhythmic drugs have prodysrhythmic actions, they can exacerbate existing dysrhythmias or generate new ones. Most adverse effects are cardiac related. There is evidence of increased mortality with many of these drugs. Use of these drugs should be limited to situations in which there is a clear benefit and only if that benefit outweighs any risks. A nurse is teaching a patient who is about to undergo direct current, DC, cardioversion to treat atrial flutter. The patient has been taking verapamil and warfarin for 6 months. Which statement by the patient indicates understanding of the teaching? A. I may need long-term therapy with another cardiac medication after the procedure. B. I should stop taking warfarin a few days before the procedure. C. I will need to take a beta blocker after the procedure to prevent recurrence of atrial flutter. D. I will not have to take antidysrhythmic medications after the procedure. Answer. A. I may need long-term therapy with another cardiac medication after the procedure. Rationale. After cardioversion for atrial flutter, patients may continue to need long-term therapy with either a Class IC agent or a Class III agent to prevent recurrence. Patients undergoing DC cardioversion need to take warfarin 3 to 4 weeks before the procedure and for several weeks afterward. Beta blockers are not indicated for post-procedural prophylaxis. Class IC and Class III agents are antidysrhythmic drugs. A patient with atrial fibrillation is taking verapamil, Kalen. The patient has read about the drug on the internet and wants to know why a drug that affects the rate of ventricular contraction is used to treat an abnormal atrial contraction. What will the nurse tell the patient? A. Drugs that treat ventricular dysrhythmias help to restore normal sinus rhythm. B. Atrial dysrhythmias can have life-threatening effects on ventricular function. C. Treating ventricular dysrhythmias helps prevent the likelihood of stroke. D. When ventricular contraction slows, atrial contraction is also slowed. Answer. B. Atrial dysrhythmias can have life-threatening effects on ventricular function. Rationale. Dysrhythmic activity in the atria does not significantly reduce cardiac output but can be dangerous when dysrhythmic impulses cross the AV node, causing ventricular dysrhythmias, which can be life-threatening. Treating ventricular dysrhythmia helps improve ventricular pumping. These drugs do not restore normal sinus rhythm. To prevent stroke, an anticoagulant, such as warfarin, is used. Slowing ventricular contraction does not affect the rate of atrial contraction. Restoring normal sinus rhythm requires cardioversion. Short-term treatment with amiodarone or sotalol, or RF ablation of the dysrhythmia source. Which two classes of antidysrhythmic drugs have nearly identical cardiac effects? A. Beta blockers and calcium channel blockers. B. Beta blockers and potassium channel blockers. C. Calcium channel blockers and sodium channel blockers. D. Sodium channel blockers and potassium channel blockers. Answer: A. Beta blockers and calcium channel blockers. Rationale: calcium channel blockade has the same impact on cardiac action potentials as does beta blockade. So these agents have nearly identical effects on cardiac function. That is, they reduce automaticity in the SA node, delay conduction through the AV node, and reduce myocardial contractility. Potassium channel blockers act by delaying repolarization of fast potentials. Sodium channel blockers block sodium channels to slow impulse conduction in the atria, ventricles. And his Purkinje system. A patient will be taking amiodarone, codarone. Which baseline tests are necessary before this medication is started? Select all that apply. A. Chest radiograph and pulmonary function tests. B. Complete blood count with differential. C. Ophthalmologic examination. D. Renal function tests. E. Thyroid function tests. Answer: A. Chest radiograph and pulmonary function tests. C. Ophthalmologic examination. E. Thyroid function tests. Rationale: amiodarone has many potential toxic side effects, including pulmonary toxicity, ophthalmic effects, and thyroid toxicity, so these systems should be evaluated at baseline and periodically while the patient is taking the drug. A complete blood count is not indicated. Renal function tests are not indicated. A prescriber is considering prescribing the amiodarone derivative dronedarone, Multic, for a patient with atrial flutter. The nurse should be concerned about which of the following: A. History of asthma. B. History of hypothyroidism circa PR interval of 260 milliseconds. D. QT interval of 520 milliseconds. Answer: D. QT interval of 520 milliseconds. Rationale: because dronedarone prolongs the QT interval by about 10 milliseconds, it should not be used in patients with a QT interval of more than 500 milliseconds. It does not have significant pulmonary or thyroid toxicity. It should not be used in patients with a PR interval of more than 280 milliseconds. A patient is in the intensive care unit after a myocardial infarction. The nurse notes that the QT interval on this patient's electrocardiogram has been elongating. The nurse is concerned that which cardiac dysrhythmia may occur: A. AV block. B. Bradycardia. C. Supraventricular tachycardia. D. Torsades de pointes. Answer: D. Torsades de pointes. Rationale: torsades de pointes is a dysrhythmia that can occur with prolongation of the QT interval and can progress to fatal ventricular fibrillation. A prolonged QT interval does not signal the development of AV block, bradycardia, or SVT. When monitoring a patient who is taking quinidine, Quinidex, the nurse recognizes that possible adverse effects of this drug include which of these conditions? Select all that apply. A. Weakness. B. Tachycardia. C. Gastrointestinal upset. D. Tinnitus. E. Ventricular ectopic beats. Answer: C. Gastrointestinal upset. D. Tinnitus. E. Ventricular ectopic beats. When assessing a patient who has been taking amiodarone for 6 months, the nurse monitors for which potential adverse effect: A. Hyperglycemia. B. Dysphagia. C. Photophobia. D. Urticaria. Answer: C. Photophobia. A patient has been prescribed lidocaine, xylocaine. What does the nurse understand is the reason for this medication order? A. Bradycardia. B. Ventricular arrhythmias. C. Atrial arrhythmias. D. Heart block. Answer. B. Ventricular arrhythmias. Rationale. Lidocaine is a sodium channel blocking drug used specifically to treat ventricular arrhythmias. When the nurse is teaching a patient about taking an antidysrhythmic drug, which statements by the nurse are correct? Select all that apply. A. Take the medication with an antacid if stomach upset occurs. B. Do not chew sustained-release capsules. C. If weight gain of 5 pounds within 1 week occurs. Notify your physician at the next office visit. D. If you experience severe adverse effects. Stop the drug and notify your physician. E. You may take the medication with food if stomach upset occurs. Answer. B. Do not chew sustained-release capsules. E. You may take the medication with food if stomach upset occurs. The nurse is administering lidocaine and considers which condition, if present in the patient, a caution for the use of this drug. A. Tachycardia. B. Hypertension. C. Ventricular dysrhythmias. D. Renal dysfunction. Answer. D. Renal dysfunction. A patient calls the family practice office to report that he has seen his pills in his stools when he has a bowel movement. How will the nurse respond? A. The pills are not being digested properly. You need to take them on an empty stomach. B. The pills are not being digested properly. You need to take them with food. C. What you are seeing is the waxy matrix that contained the medication, but the drug has been absorbed. D. This indicates that you are not tolerating this medication and will need to switch to a different form. Answer. C. What you are seeing is the waxy matrix that contained the medication, but the drug has been absorbed. A patient with a rapid, irregular heart rhythm is being treated in the emergency department with adenosine. During administration of this drug, the nurse will be prepared to monitor the patient for which effect? A. Nausea and vomiting. B. Transitory asystole. C. Muscle tetany. D. Hypertension. Answer. B. Transitory asystole. The patient has been prescribed ibutylide, Corbert, a class 3 antiarrhythmic drug. The nurse is aware that this drug has been prescribed for which reason? A. Treatment of PSVT. Conversion of recent onset atrial fibrillation and flutter. C. Conversion of life-threatening ventricular arrhythmias. D. Treatment of dysrhythmias in patients with acute renal failure. Answer. B. Conversion of recent onset atrial fibrillation and flutter. Correct. Rationale. Ibutylide is specifically indicated only for treatment of recent onset atrial fibrillation and flutter. Adenosine is used to treat which condition? A. Atrial fibrillation. B. Atrial flutter. C. Paroxysmal supraventricular tachycardia, PSVT. D. Second-degree atrioventricular block. Answer. C. Paroxysmal supraventricular tachycardia, PSVT. Rationale. The only therapeutic indication of use for adenosine is the treatment of PSVT. A patient is in the clinic for a follow-up visit. He has been taking amiodarone, codarone, for almost 1 year, and today he tells the nurse, "I am noticing some blue color around my face, neck, and upper arms. Is that normal?" Which is the nurse's correct response? A. This is an expected side effect and should go away soon. B. This is a harmless effect. As long as the medication is working, we'll just monitor your skin. C. This can happen with amiodarone. I will let your doctor know about it right away. D. How much sun exposure have you had recently? Answer. C. This can happen with amiodarone. I will let your doctor know about it right away. The nurse notes in the patient's medication history that the patient is receiving a lidocaine infusion. Based on this finding, the nurse interprets that the patient has which disorder? A. Atrial fibrillation. B. Bradycardia. C. Complete heart block. D. Ventricular dysrhythmias. Answer. D. Ventricular dysrhythmias. If a drug has a prodysrhythmic effect, then the nurse must monitor the patient for which effect? A. Decreased heart rate. B. New dysrhythmias. C. A decrease in dysrhythmias. D. Reduced blood pressure. Answer. B. New dysrhythmias. A patient is about to receive a dose of verapamil, Kalen. The nurse notes that this medication is used to treat which condition? A. Cardiac asystole. B. Heart block. C. Ventricular dysrhythmia, including premature ventricular contraction. D. Recurrent paroxysmal supraventricular tachycardia, PSVT. Answer. D. Recurrent paroxysmal supraventricular tachycardia, PSVT. A patient will be starting therapy with quinidine, Quinidex. Which of these drugs, if also on the patient's medication list, may cause a potential drug interaction? Select all that apply. A. Cimetidine, Tagamet. B. Amiodarone, Codarone. C. Digoxin, Lanoxin. D. Warfarin, Coumadin. E. Erythromycin, Erythrocin. Answer. B. Amiodarone, Codarone. C. Digoxin, Lanoxin. E. Erythromycin, Erythrocin.